Dr. Luby and I have the great pleasure of introducing our keynote speaker, Dr. Anna Stewart Ibarra. Dr. Anna Stewart Ibarra is the Executive Director of the Inter-American Institute for Global Change Research, and an expert on climate and health in Latin America and the Caribbean. Dr. Stewart Ibarra's research has focused on understanding climate, environment, and the social drivers of vector-borne diseases and other dimensions of human well-being in Latin America and the Caribbean. For more than 14 years, she has collaborated with academic and government institutions in the region to conduct community-based social, ecological, epidemiological, and modeling studies. She recently edited a forthcoming book with our own Desiree Lebeau called Transforming Global Health Partnerships, Critical Reflections, Visions of Equity at the Research Practice Intersection. Today, she'll share her insights on how to foster equitable scientific partnerships focused on climate and health, and based on her experience developing global health research collaboration in Latin America and the Caribbean as a scientist. Dr. Stewart Ibarra, thank you very much for coming all this way to come to our research community. Thank you. She spent many hours on a flight and one flight that was canceled, so we're really happy that you're here.
Good morning, everybody. Well, thank you to the organizers of the Stanford Center for Innovation in Global Health, the annual research convening, for inviting me to join you here today. Thank you, Michelle, Steve, Desiree, Professor Martinez, Ola, and Christina, and everyone else who's been involved in this fantastic event. So the focus of today is on partnerships, near and dear to my heart. Who we work with, how, and why. And inversely, who we exclude, whose voices are silenced, and how we condition those relationships. I want to open with this metaphor of weaving. The weaving of partnerships and a view of life on Earth as interwoven and interconnected with all other people and with life. One planetary tapestry. Sandra Diaz, a leading biodiversity scholar from Argentina, beautifully states in this article, by thinking about the living world as an intermeshed fabric, we start to shift or broaden the spotlight of inquiry and action, making them more focused on connections and entanglement, more interdisciplinary and socially inclusive. This is a small but necessary step to rally a wider range of society into producing new knowledge and spurring action for a better future. Action for a better future. COVID-19 was a wake-up call to humanity, and certainly for the field of global health. An opportunity to come together in solidarity and to care for each other, to address the deep systemic inequities that exist, and yet we continue to envision and respond to these growing global crises as though they were isolated issues, through piecemeal solutions like this little person saying, "Be sure to wash your hands and all will be well." The good news is that many thinkers and doers are transforming the field of global health and beyond, from integrated approaches like planetary health and transdisciplinary science, to decolonial and indigenous frameworks, to governance structures like Bolivia's Ministry of Decolonization and Depatriarchalization. Without getting into the details of these approaches, common threads include a focus on social justice and equity, particularly for indigenous people and local communities, interconnectedness, and ultimately the goal to increase well-being of life on this planet. So if we can basically agree that an integrated and interwoven approach is needed, my question is, what does this mean for partnerships? How does this change how and with whom we partner and under what conditions? And how do we place relationship at the center of global health? First, I will explore this question through my experience as an academic scientist, sharing my experience participating as part of a research teams in Ecuador and the Caribbean to develop and implement early warning systems for climate-sensitive infectious diseases like dengue fever. I'll share a little bit about my academic background. I began studying dengue fever in southern coastal Ecuador in 2007. I am also Ecuadorian and a US citizen. At the time in Ecuador, little was known about this emerging mosquito-borne viral disease, which had become recently hyper-endemic. The first major outbreaks of dengue in Ecuador and through most of Latin America occurred in the late 1980s and early 90s. So I began working with the Ministry of Health and the National Institutes of Meteorology and Hydrology to understand the underlying social and climate drivers of disease transmission, the basic epidemiology and disease dynamics, and to think about possible solutions and tools like early warning systems. But most importantly, I learned about partnerships with communities and government agencies. I learned about building trust and legitimacy with communities and local media, about listening with humility and adapting my ideas, and using my position of privilege to support my partners. In 2017, I began to work with a team of researchers led by the Ministry of Health and Wellness of Barbados and the Caribbean Institute of Meteorology and Hydrology to co-create a dengue early warning system. This effort built on the last decade of research in Ecuador, but had the advantage of being situated in a country that had already prioritized work on climate and health at a high political level. The Ministry of Health had identified arboviral diseases as a major public health concern. The Zika epidemic had spread through the Americas the year before, and chikungunya right before that. Dengue fever outbreaks were on the rise. They were also aware that changing climate conditions were increasing the risk of disease outbreaks. And as a small island developing state located in the Eastern Caribbean, whose economy was largely dependent on tourism, they saw the urgent need for tools to respond to the growing risk of disease outbreaks. Our team has focused on a collaborative modeling approach with qualitative and quantitative methods to co-create a dengue early warning tool. Through ongoing dialogues, we have met to discuss and listen to the needs and interests of the health and climate sectors, to hear about their current capabilities, and to think about solutions. Prototype models have been created and presented to the group for feedback, allowing the model to be refined, improved, and simplified. Through this collaborative co-development process, the final product is more likely to be relevant, credible, and legitimate, increasing the potential for the tool to be used for day-to-day decision-making in the health sector. The team identified a number of key political and institutional mechanisms that would allow the early warning tool to become operational and sustained over time. Importantly, they noted the need for a political mandate for the health sector and climate sector to address the impacts of climate on health. Because at that moment when we were working there, the issue of climate and health was not addressed by any specific ministry. It sort of fell between the cracks of the different sectors. And without this mandate, it would be difficult for them to justify dedicating resources to support these efforts over the long term. They also identified the need for formal institutional arrangements like data sharing agreements, collaboration agreements, and standing committees that would allow them to work together on a regular basis. These may seem like mundane or obvious recommendations, but in my experience in Barbados and other countries, without strong institutional partnerships, political will, and sustained government funding, even the most accurate or sophisticated early warning system or other sort of scientific tool has no hope of ever being implemented. The team successfully developed a dengue forecast tool that uses climate information to predict the risk of dengue outbreak several months in advance. Both excess rainfall and drought conditions could potentially increase the risk of disease outbreaks. And the model has been updated to use an impact-based forecasting framework, which is more compatible with current practice of the National Meteorological Services. And right now we're working to find solutions to host the tool online and ensure its sustainability. 7 years later, the work in Barbados continues in partnership with the Caribbean Public Health Agency. Several factors in Barbados favor this partnership beyond the collaborative modeling process that I already talked about. First, climate and health had already been prioritized by high-level government agencies, and the climate and health sector were keen to work together. We prioritized listening to their needs, interests, and capabilities. Second, the research was demand-driven. The regional agencies had been given the funding and control over the funding, and they sought input from experts to address their needs. This helped to level the potential power imbalances that often occur when working with scientists from the global north. Third, strong governance, robust surveillance systems, and stable political leadership allowed the collaboration to flourish over many years. Also, the countries, Barbados in particular, was English-speaking, which greatly facilitated the collaboration. And language does matter, and I'll touch on this later in my talk. Certainly there are countries that are English-speaking have an advantage when it comes to doing global health work. Now I'm going to put on my other hat to share my experience on climate and health partnerships from the perspective of an international civil servant working for an intergovernmental organization in the Americas. In 2019, I made the jump from academia to join the Inter-American Institute for Global Change Research, the IAI. We are an intergovernmental body serving 19 countries of the Americas. We were established over 30 years ago by a treaty signed by our member countries, and we were created to address the growing threat of global environmental changes that transcended the boundaries of any single nation, like climate change, pollution, biodiversity loss, emerging epidemics like the COVID-19 pandemic, and the need for regional scientific cooperation to generate data and information that governments could use to inform their decision-making processes. We serve our member nations by developing funding calls that respond to their priorities, by funding multinational research networks, by training scientists, social actors, and policy practitioners, and by elevating the priorities of our member states in global multilateral forums like meetings and conventions of the United Nations. Today, the most pressing issues identified by our member states are climate change, the loss of biodiversity and ecosystem services, water scarcity, health, inequity, and poverty. When I began in 2019, I served as the science director of the IAI, and in June 2023, I assumed the role of executive director. The directorate of the IAI is based in Uruguay, where I now live. And as an intergovernmental organization, we report directly to the 19 governments who we serve. Each government delegates an official representative to the IAI through their State Department or Foreign Affairs Ministry. For example, the U.S. representative to the IAI is based at the National Science Foundation on behalf of the U.S. Global Change Research Program. Once a year, our country representatives meet at the IAI's Conference of the Parties to discuss their priorities and the Directorate's work plan for the following year. And our work is guided by scientific advisory bodies of experts nominated by the countries. In the photos here, this is from our most recent Conference of the Parties hosted by Panama last June. We focus on two main strategies of the IAI: transdisciplinary approaches to global change science and science diplomacy, which I'll touch on a bit later, the science diplomacy part. Transdisciplinary approaches refer to research collaborations that bring together scientists from social sciences, natural sciences, with non-academic experts from local communities or government to co-produce knowledge. This approach is recommended as a best practice when an issue is highly complex, transcending any one discipline, highly uncertain, and there's a need for urgent solutions. Certainly, most of the issues that global health addresses could fall under this umbrella. And equitable collaborations are at the heart of the transdisciplinary process. Team members explicitly address the inequities that shape the dynamics both within the team and in the social context where the research is situated. One of our core transdisciplinary research partners is the Belmont Forum. Belmont Forum is a global consortium of science funders and resource partners, and today I serve as one of the co-chairs. The IAI hosts the Belmont Forum in Uruguay, although the Belmont Forum, again, is global in scope. The Belmont's mission is to support transdisciplinary research on global environmental challenges similar to the IAI. The Belmont is unique because it brings together funding agencies worldwide who agree upon common issues, common topics, and they coordinate their calls for grants. This allows multinational consortium to apply for grants through one agreed upon grant review portal and process. And the Belmont Forum, you can see, has been around, it doesn't say here, since 2009, and I believe to date there are over 20 different collaborative research actions which have been issued. The collaborative research actions are the funding calls. One important element is that every group that's funded by the Belmont Forum has to have at least 3 countries involved, and it has to have a transdisciplinary core that I already referred to. The team members has to come from social sciences, natural sciences, and outside of academia. So I'm going to talk a little bit about our work with the Belmont Forum and other partners to mobilize a regional research and action agenda on climate, environment, health in the Americas and globally. A few years ago, the National Science Foundation began developing a new funding call focused on the nexus of climate, environment, and health. And here you can see some of the themes that have been included in the call for proposals. As I'll talk about in the next few slides, the IAI was key in identifying the priorities of Latin America and the Caribbean. and more importantly, in preparing the region to be able to effectively engage in this funding call. All Belmont Forum funding calls are developed through a participatory process called scoping. Virtual and in-person workshops are held with diverse stakeholders to ensure that funding calls respond to the most critical needs of different communities. We held virtual multilingual workshops with people from across the Americas and asked them about their priorities of the nexus of climate, environment, and health. Interestingly, more so than specific topics like heat or vector-borne disease, people wanted to talk about the how the work was being done, and the for what. Here you can see that they prioritized the need for transdisciplinary training in science communication, the need to create open access tools that would be replicable, the need for processes of co-development, and the need to strengthen existing or new communities of practice that bring together scientists with decision makers. These outcomes then directly inform the priorities that were included in the call for guidance that was developed. So we listened to the community and we began developing massive free online training courses in partnership with the Pan American Health Organization, with Columbia University's Global Consortium on Climate and Health Education, and other partners like Health Canada and the World Meteorological Organization. And the response was incredible. It blew us away. The first course we launched had more than 2,000 people enroll, around 1,000 people connected live twice a week for sessions, mostly from Latin America. But what made the training so effective was that it was delivered in Spanish primarily, but with interpretation to English, and delivered by experts from the region to the region, at no cost as well. And the participants received a certificate at the end. This experience showed us that there was a large, active, engaged, and very knowledgeable community of people already working on climate and health issues in the region. And we've since held a number of trainings, similar trainings on climate and health on different, more specific topics, most recently on El Nino and health. As many of you know, we're currently in an El Nino year, and many countries in the health sector are particularly worried about the impacts of El Nino on different health issues. And right now we're in the process of launching a new course on climate, health, and migration. Some of these courses have since been flipped into freely available asynchronous courses on the II's virtual campus, and all of the course materials and recordings are freely available online. So following this initial training, we then began an intensive process to form and mentor transdisciplinary research teams made of individuals from across our member states in the Americas. We issued an open call for teams to participate in the process, and to participate they had to first submit an initial idea, and each team had to have, again, this transdisciplinary core that I referred to, at least one social scientist, one biophysical scientist, and one person outside of academia as part of the core team. Over 70 teams applied from across the Americas, and we selected the top 26 teams to participate in this training process. We then opened up the training to anyone from governments who wanted to participate, because we wanted to really encourage and strengthen this research policy nexus. And we then, during the training, worked to match government policy practitioners with existing teams. We also worked with the teams to merge them, to create multinational teams to address similar related research questions. So the teams went through an intensive training program with virtual and in-person training and close mentorship. And in the end, after completing this 6 to 9 month process, they submitted a completed proposal which was awarded for funding by the II, a seed grant proposal. So today we are now funding 12 research projects in 15 countries with 134 investigators involved. 10 of the 12 PIs are women, 1/3 are early career investigators. The other part of this process, which was incredibly important, was that during the in-person workshop, half of the participants were policymakers and decision makers. About 100 people participated in the in-person training workshop from 20 countries. And so being able to have decision makers and scientists sit together and identify the most critical priorities was a really unique opportunity, which I am sure is laying the seeds for work in the region over the next decade or more. Some of the lessons learned from this process: it is critically important that we build and support shared spaces and research processes where decision makers, civil society, and scientists can come together and work closely in equitable partnerships. The II has been playing this role for over 3 decades, and this is more important than ever. We need to invest in capacity building before a funding call is launched. I'm going to say this again. We need to invest in building capacity before a funding call is launched. If we don't do this, we will continue to support the status quo, We will continue to fund the small group of elite researchers who have access to international networks. This is at the heart of equity, diversity, and inclusion in science. This experience also showed us the power of building, in this case, regional partnerships with other organizations so that we could leverage together and pool our existing resources. For example, the virtual training programs that I mentioned were done at no extra cost. We didn't have any big grants to support this work. But it was incredible how the different organizations and agencies came together with a common vision. And we have the power to move mountains when we work together. Lastly, language matters. Throughout the training, we emphasize multilingual communication and people from the region training and working directly with teams from the region. Many, if not most, of the proposals that we received and reviewed were in Spanish. And we need to break down the harmful myth that English is the language of science. In these next few slides, I'll share some of what's coming down the pipeline at the IAI. So I'm thrilled to share with you that we are in the process of launching a new funding call focused on tropical forests worldwide. There are health threads that are woven throughout this funding call. We spent the last year and a half developing and scoping this funding call in partnership with FAPESC, the Science Funding Agency of Sao Paulo, and we hope that the call will be launched around the middle of 2024. We will implement a similar training program as we did for the Climate, Environment, and Health funding call with virtual and in-person training and seed grants. We aim to strengthen the capacity of the Americas to respond to this global call for grants. The other exciting news is that we are pushing for this call to be the first multilingual funding call issued by the Belmont Forum. This has the potential to radically change who is able to access funding. And as you can imagine, while we were in the process of developing this funding call and holding scoping workshops with government officials, with community leaders, with indigenous leaders from across the Americas, it became more apparent than ever that the idea of maintaining the status quo, which would have been issuing a funding call in English, was just wildly unethical. How could you issue an English funding call to work in regions where the first language is not English, and yet say and claim that we want to have communities and indigenous people at the heart of the funding call? And so I am very grateful to the National Science Foundation for having put in the money and invested in the Belmont Forum grant submission portal. There's a significant investment needed to make this become multilingual, and that has already been committed. Along the same lines, the IAI adopted, the IAI parties, so remember these are 19 countries who have come together, and they adopted a policy of equity, diversity, and inclusion in sciences. And we've been now working to mainstream this policy into all of our work. So at the last conference of the parties that I mentioned in Panama, there was a new decision to adopt for the first time an advisory body comprised of indigenous peoples and people from local communities. And these people will directly advise the governments in the implementation of our science agenda and our strategic plan. This is really important because this committee will sit side by side with our Science Advisory Committee and with our Science Policy Advisory Committee. In other good news, the Belmont Forum, again a consortium of 39 global science funding agencies, are also moving forward to adapt and adopt their own EDI policy based on the IAI's policy. And lastly, as I mentioned, we'll be testing for the first time a multilingual grant submission platform. We will continue to expand our training through new virtual campus courses and a number of new materials that we made available this year. Here you can see that we will have 2 self-paced courses that will be available in the coming months, which will be in English, Spanish, and Portuguese. One will be on transdisciplinary approaches and the other on science diplomacy. Both of these courses will be grounded in case studies from the region. There will be a book that will be published of case studies to accompany the courses. And we have also put together a library of transdisciplinary tools, multilingual tools. So through this process, we've learned about the importance of fostering equitable partnerships during the training itself. And this has become critically important to shape our pedagogical commitments that you can see here, which will then guide the work we do across the IAI going forward. And if you see on the slide, it talks about putting case studies and context-specific examples at the heart of the training, working to build relationships and build networks and engagement during the process of training itself, centering local and traditional knowledge within the training program. This transdisciplinary approach is complemented by our focus on science diplomacy. And here you can see a classic definition of science diplomacy. Science in diplomacy, diplomacy for science, and science for diplomacy. Last year at our Conference of the Parties, the countries decided to establish a new regional science diplomacy center. And the center aims to foster science policy dialogue, strengthen engagement in multilateral science policy processes, and enhance collaborations in the Americas to address the challenges of global change. In this short video, the II's Deputy Director, Marcela Ojeda, will tell us about the Science Diplomacy Center.
The III Science Diplomacy Center represents an evolution of the extensive work executed by the Institute over the last 30 years. The center builds on the III's wealth of scientific knowledge, collaborative research networks, and innovative training approaches for transdisciplinary research in global change on policy-relevant topics, such as climate change, ocean, biodiversity, ecosystem services, water resources, among others. The center will work with III member states to develop inclusive and effective science diplomacy mechanisms that combine examples from the global North and South, integrating diverse Latin American and Caribbean experiences. With the launch of the center, we invite the III member states, governments, and communities of the Americas to engage with the activities of the center to nurture multilateralism and support regional collaboration to tackle urgent environmental issues no single nation can face alone.
So most recently, when we were at the UNFCCC Conference of the Parties in Dubai, we worked to promote climate and health dialogues across governments of the Americas with scientists and actors from civil society. Here you can see Admiral Levine from the US with high-level officials from Colombia, Panama, Argentina, and Guatemala. And this event was co-hosted by the Guatemalan government in their pavilion. The III also recently held a training for government officials in science diplomacy in partnership with the Panamanian government, who were the local hosts and sponsors of the training. We had 50 participants from 11 countries in the lead up to the UNFCCC COP to help prepare our member states to better engage in these multilateral negotiations. And this training and these sorts of experiences are working to build a network of people across the Americas who are engaged in science diplomacy, to strengthen international cooperation, and to support the role of science in policy. I'll also mention that one of the outcomes of this workshop was that a number of other countries have already offered to host and sponsor other trainings for the region, and so we will have upcoming annual trainings now planned for Brazil, Paraguay, and possibly Chile over the next several years. One other outcome is the Panama Declaration. For those who are interested, you can read more. And this is a specific declaration about the role of science diplomacy in the Americas, which was authored by the participants who were at the workshop in Panama. The Science Diplomacy Center also houses one of our most successful programs, the Science, Technology, and Policy Fellowship, or STEP Fellowship Program. This program began only 3 years ago and has grown to include 68 fellows from 14 countries. Fellows are mostly postdoctoral level scientists who are placed in government agencies over a period of 1 to 2 years. They receive training in diplomacy, leadership, and communication, and then this culminates in an in-person conference where they present group projects that they've developed on different science diplomacy topics. And the beauty of this program is that people are working together across different countries, and again, building that network of professionals and experts across the Americas who have this shared vision of science diplomacy. Without a doubt, this program is creating and fostering the next generation of science policy leaders and partners across the Americas. So in the next slide, you'll see a short video with the leadership statement, the vision of leadership that these fellows wrote just last year.
recuperación del liderazgo de los becarios STEM. Por ejemplo,
We leaders in science diplomacy,
Preocupadas e preocupados com as gerações atuais e futuras e com o nosso planeta,
which are affected by structural challenges,
loss of connections among humans and with nature,
por las desigualdades sociales, los modos de vida explotadores y sus impactos en la salud mental,
acknowledging that harmful social hierarchies perpetuate injustice,
and recognizing the need for transformative and radical change in the Americas,
motivados por el deseo de bienestar personal, social y ambiental,
inspiradas e inspirados por pessoas que já trabalham para melhorar os modos de vida,
interesados sobre métodos innovadores para generar consenso,
and valuing diversity and collective action.
buscando oportunidades para construir relaciones que hagan audibles las voces ignoradas.
encontrem uma base comum, levem a confiança e equidade.
Declaramos que nos esforzamos por ser oyentes empáticos, empáticas, activos, activas,
and learners with compassion to promote inclusive and collective discussion and decision-making across cultural and national differences.
Nos proponemos trabajar constantemente en nuestro autoconocimiento y en la voluntad de ser
vulnerables, de manera que podamos invocar una mayor confianza y esperanza compartidas a través de las comunidades y de las fronteras.
comprometemos-nos com mudanças transformadoras relevantes para além de incrementar.
by creating and utilizing innovative methods that are flexible to evolving realities,
fomentamos el reconocimiento de la diversidad de los conocimientos y las sinergias que existen,
minimizando monopólios de barreiras do conhecimento
Y el avance hacia la inclusión colectiva.
Aplicamos enfoques transdisciplinarios
Que fomentan la colaboración,
creando capacidades y soluciones efectivas, transcending limitations of acting and thinking as individual people and nations.
We build trust and equity among societies.
mientras abordamos los desafíos más urgentes.
que enfrentan las Américas.
While all differences may not be reconciled,
Nós nos comprometemos com respeito mútuo
and civility for progress.
We strengthen and expand involvement of diverse stakeholders in knowledge,
innovation and diplomatic action beyond individuals in the IAI,
Ciencia y tecnología and Policy Fellowship Program.
I wanted to mention also that this program was modeled after the successful Science Technology Policy Fellowship Program here in the US. The AAAS began in the 1970s. In Canada, MyTax has a similar program. Many countries in the global north have similar programs. But this is the first time such a fellowship program was created that included countries of Latin America and the Caribbean. And certainly the first time such an initiative brought people together across many nations. And so there are many participants, again, from AAAS, MyTax, and other countries, and it's just been amazing to see how this has grown. And we now have our first Climate and Health Fellows based at the Pan American Health Organization as well. So this is, to me, one of the most exciting parts of being here. I traveled almost 30 hours to be here with you today, and part of this is because, thanks to friendship and work with Desiree, we're here to also announce the book that we've been working on, our HEART project, for the last 4 years, during a pandemic, during my baby being born. Just amazing. So, announcing our book, which we hope will be published in April of this year. There are flyers over there. Springer will be publishing the book, completely open access. We fundraised over $20,000 from the authors of the book to ensure that this book will be available to everyone worldwide. Thank you to Mira, if she's here, for doing the beautiful artwork for the book. And the book has been divided into 3 sections. We talk about the foundations of global health, many of the things that I touched on today, sort of where we are today is in the case studies, and where are we going under future visions. What's amazing about the book is that we have over 90 authors from 26 countries, and we asked people to tell their stories. So I hope you will read the book, and when you do, don't be surprised if it feels like a textured weaving. The stories, the voices, there is this feeling of unevenness. Not every chapter is the same. It was not meant to be a textbook. You know, we encourage people to speak from their place of I, from their place of power, to bring in theory and practice and science, but from their place of their personal experience and their stories, to be vulnerable, to talk about what worked and didn't work, in their personal journeys as global health scholars, practitioners, community leaders, artists, healers, activists, and so on. And so many of the authors will be with us tomorrow also. But our hope is that this book sparks conversation, sparks dialogue. The goal of this book was not to be a manual on how to do global health. This is not supposed to be the end-all or be-all of, of global health partnerships, but humbly to offer an example, some stories of people around the world who are doing it in different ways. And so I invite you to be a part of our book in this discussion and to see what comes from here. And again, this has been about 4 years of work. It's been, and told Desiree, it's almost incredible. I don't know how we did a book in between everything else that we do, but it was because it was just an amazing experience. And doing the book itself transformed us. The process of reflection and the process of reading and working with authors all over the world was, the process was what was about more than the book itself, which is really amazing to be able to reflect on that now. And so when Desiree and I were at the end of this process, we had asked all of the authors to put at the beginning of their chapter key tenets. And so we went back and pulled out all the key tenets from the 26 chapters, and we began to synthesize and think about what was really at the heart of global health partnerships. And when you see the book itself, I don't know, there's a bunch of them. There's maybe 11 or 12 key tenets. But what I did yesterday was I went back and looked at the ones and pulled out the words that resonated most with me right now as I was preparing this talk for you, but recognize that there's a lot more that I didn't include here. And what I felt like resonated here was about, first, this acknowledgement of where we are today, acknowledgement about the injustices and the roots in global health and beyond, starting with that, how we can actively think about disrupting the status quo, that this is part of the work that we do in the world, how we repair our interconnectedness. But at the same time, we are carried by the joy and the power of human connection. How we can focus on trust and stay open and humble to learning and growing together. How we can continue to work within the imperfect systems that we're in to drive change and be agents of change while bringing our whole selves in service. And we need to persist in hopefulness. That is the power, I think, to carry and drive the change in the world. So at the end, it's not just what we do or who does it, but how we work together in global health. So join us tomorrow, if you're able, either online or even better, in person. We will be meeting with many of the book authors and others from the community here at Stanford to talk about this process and to hear from everyone. And I really hope you can join us. So, in closing, I continue to be passionate about how we work together in global health and beyond. I continue to be hopeful that we can change how we work together for the benefit of all. And I am deeply grateful for the opportunity to be here, to share with you, and to partner to make the changes that we need to see in the world. I wanted to share with you the image of the condor and the eagle. There is a prophecy that describes the condor and the eagle flying together for a better world. The condor represents the wisdom of the south and the eagle the wisdom of the north. We need to work together to bring all of our gifts, to be able to serve, and to evolve and grow together. And I believe this is why we are here today. So thank you again to the Stanford Center for Innovation in Global Health, and I'm happy to take any questions.
Thanks, Anna. Thanks for talking about your trajectory, your experience, and this whole rethinking about how we engage as partners. So I'm Steve Luby, the Director of Research for the Center for Innovation Global Health. I would like everyone who has a question to come up and get in line at the microphone. Let me just start off. Well, I guess I was worried that somebody wouldn't come so quickly, but Erin looks ready to go. So over to you, Erin.
Thank you, Anna. That was amazing. And it's wonderful to see you after all these years. We had a chance to work together a long time ago on that dengue work in Ecuador. I was wondering if you could share with us maybe one of the more compelling case studies that you use in these trainings or that you cover in your book. If you could just tell us a little bit of that story, some of the salient features that you think would be interesting for us to hear about.
Question, Erin. You know, what I love about the case studies in the book is that they're all so different. You know, we have some, so I'm gonna pick up, is Josefina here? No? She's coming tomorrow. Josefina Coloma helped to introduce us to one of her colleagues, Harold, who wrote a book. His case study was autobiographical, and it was so beautiful. And so I got to know it really well because I translated it because he wrote it in Spanish. And it was about his journey coming from a very low-income community, and then his process to become a social science researcher and a global health researcher within his same communities. And I think he says something simple like, remember that communities think and feel, they're not objects. Like, this sounds obvious, but this is not taught often in academic circles. But his story is so moving, and there were so many others. Cristina Migari was also part of the Stanford community, and her colleagues wrote beautiful chapters about their journey as African women scientists, physicians. And they wrote them each from their first-person perspective, but then used metaphors of different animals to describe their journeys and the challenges, but also what came out, and where they're going. Others looked at, much more kind of traditional kind of case studies of public health interventions and how there were effective partnerships working with communities and with the public health sector. Steve could talk about his case study, working, to look from a One Health perspective, addressing epidemics in Bangladesh. So there's just such a beauty of voices in the book, and I hope you get to see it.
Thank you. I can't wait to read it.
Thanks, Erin.
You've had a lot of experience and described a lot of efforts to try to improve best practices. That suggests to me that you probably also observed some practices that weren't always optimal. So I wonder if you could talk about some of the common mistakes that you see from high-income country researchers as they walk into this domain of global health research.
Yeah, that's a good question. I think one of the biggest barriers and facilitators is money, right? So when large research dollars, biomedical research dollars start to come into the equation, often the partnership changes, the dynamic changes. Who has power? Who makes decisions? Who sets the priority can change radically. Some of that is driven by sort of the single PI-based model, NIH models of funding that push for academic researchers to really to have to sort of play a protagonist role and have their ideas and their creativity be front and center. And so that kind of funding model, when you bring it to a global health landscape, I think is incredibly harmful. Because it means that the researcher now, because you're having to fit into this system of promotion and tenure and funding, it's not about blaming or shaming the scientists, but it's about thinking about the systems that we're in. You're many times sort of forced to reprioritize what science is done, whose voices and who has the power about decision-making power at the end of the day. So I think that's a major challenge. You see this also when it comes to large, pharma studies, clinical trials. Like as soon as the stakes go up and the research dollars go up, I think it becomes even more important to create really strong systems to protect the integrity of the research team. Even a pre-existing research team that may have worked beautifully together could become totally turned upside down when the funding landscape changes. But I'm sure many of you have experience with that in the room as well.
Thank you for a great talk and for all of the work you're doing on it. There's John Klein from the pediatric department at the College of Medicine, fairly new to Stanford. My question or comment really has to do with how do we take organizations that are focused on science and investing in discovery and help bring the conversation to implementation, sustainability, and accountability at a system level in ways that create the same kind of excitement that individual discovery does for the community of science.
I think you have to put some regulatory frameworks around that to say you can't do discovery science if it's in a community. If you're working with real people, you can't do that. There are unethical ways of doing it, ethical ways of doing it. So some of it is the stick, but then there has to be the carrot. There has to be the incentive. And so doing the goal is not to get it to disappear or to get it, to not fund discovery or basic science, but to understand that we need that type of science to be as valued and to have applied science and transdisciplinary science approaches as valued within the system, which is not today. I would say academic researchers are largely disincentivized from doing applied and transdisciplinary science. They're disincentivized from doing, publications with many co-authors or collaborative publications where maybe you have fewer publications, but they're more synthetic. There's so many disincentives in the academic system to do the transdisciplinary approaches. And so there has to be some active leveling within the system so that you can continue to have the excitement about the basic discovery science, but that people are also rewarded and it's seen as valued and valuable to do applied science. That's part of it, I think.
Hi, thank you so much for this wonderful keynotes. My name is Agnes Halfosh. I'm a postdoc with the Department of Sociology. And my question is, what advice would you give to junior scholars who are just starting out and hoping to follow a new path for transformative and transdisciplinary scholarship to avoid falling into old patterns?
Don't be afraid. Be afraid and keep walking. Find good mentors, find allies, and trust your voice, be authentic. It was something that came up again and again, I think, in the stories that we heard, in the researchers who we spoke to. And so often, unfortunately, people don't feel like they can be authentic until they are senior, until they're established. And so when you are earlier in your career, you are vulnerable. You're more at risk of the things that I talked about before, sort of all the disincentives in the system to push you into ways that maybe make you feel you're not doing something authentic to you. And I think this is the critical role of having senior mentors, people who can open doors and support and protect the generation of people like yourself and others who have this voice and can see what's wrong, but you don't have enough power within the system to do it alone yet. And so there's a huge role for those of us who are in positions of privilege or power to use those positions to support others, be it junior people, be it people from low and middle income countries, people who speak other languages who are overlooked. So that's my answer.
So Anna, thank you very much for that keynote. A question that I have, because I struggle with it in many of the partnerships I have, is the nuanced power dynamic that comes with coming from Stanford. And even though one works at leveling that, any tips on how to do a better job of it?
Having local social scientists on your team.
There are local, but do you overtly talk about this power dynamic?
Yeah. This is part of the transdisciplinary process, but there are social scientists and facilitators who know how to do this, who are trained in it. It's not like we expect every biomedical researcher to tomorrow become a skilled facilitator. You have people who have tools to do this and who know how to do this. The field of transdisciplinary science, it's a field, it's a scholarly field. And again, there are ways to do it. So in the transdisciplinary process, this is explicit. You do this as part of the work, as part of the science also, so it's part of the team dynamic. You create spaces for these discussions that are supported, that are respectful, trusting, again, with professional people who know how to do it, because otherwise you could certainly re-traumatize or create a lot of harm, which you don't want to do. But yes, you have to put the conversations on the table in a way that is healthy.
It's a little hard when you're in the field to find those people. Is it covered in your book, or?
In the field, you mean like in the field remotely, of global health, or when you're working remotely?
Remotely, yeah. To find those people to facilitate for you.
I think if you start reaching out to sort of the community of transdisciplinary scholars, there are people all over the world. For example, I work with a group called Inclusive Innovation, and they're professional facilitators who do this, and they have people all over the world who are professional facilitators. So I'm bringing them to help me work with my teams and to think about tools, because I know I'm not a professional facilitator. I have some experience, I've done a lot of facilitation, but they have different ways of thinking and tools that they adapt from even the business world and then bring it into research and collaboration settings. So, yeah, there are smart people thinking about this, which is a good thing.
Hi, good morning. My name is Satish Kumar. I am a CEO and founder of a health tech startup. My question is that when you fabulous job in developing an early warning dengue system in Barbados, right now, particularly focused in US and many other parts of the world, the developing early warning system for many infectious diseases which are known and many which may be unknown and coming in future, particularly in the context of One Health, where many can get transmitted from the animals or different species. So did your work have any parallels at how you can go ahead and develop a generic early warning resilience systems? There are something like HealthMap from Boston General Hospital and ProMed, but since these are very practical cases study of propagation of dengue and then containment of the disease. Second question is, how do you develop a system like early warning system? This has many aspects. And one of the users is the public health people, public health department people from the government or different community health organizations. So how quickly you can develop the capacity of those people to actually use the system? There might be good intention, politically might also be there, but the capacity may not exist because this is a kind of a new way of working, new method of working, new method of communicating. So did your work have any? Did you do any work regarding that? How can go ahead and build capacity quickly?
Yeah, those are two good questions. So the first question about are there any sort of approaches for sort of more generalizable early warning systems? The short answer is no, but if I had to pick one early warning system that I think today would be easier to implement and that a lot of countries would be interested, I would focus on heat. That's something I've talked with a lot of colleagues about, is that heat is in some ways easier to model, in some ways easier to understand, and it affects many different aspects of human health and well-being across socioeconomic stratuses, although certainly people with lower income have a bigger impact. It affects people in the north and in the south. And so me coming from the vector world, today, if you had asked me where to put some money that would help to move forward a whole agenda and to get sort of the ministries of health and the climate services excited and working together, I would think about heat as like an entry point, especially in places that are not working on climate and health. The second question about building capacity is a huge question, which is why when we started working in Barbados, the first month we were there, we started asking about capacity. What capacity did they already have? What capacities did they need? You know, for example, they discussed the need for statistical modeling training or GIS training, that sort of thing. So part of it is developing tools that are actually aligned with the current capabilities of the capacities that are in-house, right? Like, we can't develop something that requires someone to go in and do our modeling behind, you know, or expect someone to be going and doing some kind of thing that is beyond an Excel spreadsheet. That was the level we were coming at, and that's okay. Our goal was not to convert everybody into, you know, mathematical modelers. But I have to say, working with other colleagues who are mathematical modelers, they didn't understand that, and it took a while to get everybody on the same page. And they thought that doing a training on R was what was meant by capacity building, and that was not the right starting place. So part of it is saying, okay, how do we build tools that can actually be used and not just trying to convince we're going to turn everybody into modelers. That's not the goal of capacity building. But that there is a basic need, for example, to bring together the climate and health sectors, to have them sit together. They asked for having joint trainings on the foundations of climate and health. Like, we need to understand the mechanisms of how climate and health work together. We did a lot of that through the online virtual trainings. And that was, you know, fairly low cost, fairly effective, reached a lot of people in a short period of time. It was sort of more of an awareness raising, right? Getting people sort of understanding the basic mechanisms. Beyond that, you sort of hit a point where you need to have a few people who are committed and stick with it and also can gain the technical skills. But that's something you could do over, if you're investing in a few, you know, individuals. I don't know the scale you're working at. Certainly you could work on training and supporting them over a few years. You know, but it is a huge question. I think it's actually the starting point. Before you even go in and think about any kind of model, you have to know who you're working with and what the community wants and what they can sustain. So, thank you for your question. It's not the best answer, but it's a good question.
Well, and thank you for your presentations. I really amazing to learn about your whole effort. I'm Pili Feng. I actually come from China. I do in a university. My research focuses on corporate social responsibility, sustainability, as well as corporate social innovation. So I work with the government, the policymakers, and also the community, trying to promote the social entrepreneurship like that. I'm just wondering, do you have any work in China, or you have some suggestion for the China society to how to get involved in? I'm kind of exciting to, yeah.
Questions. So specifically the IAI, we don't because we work with our member states in the Americas, but the Belmont Forum does because China is a very active member. The Chinese Science Funding Agency is a very active member of the Belmont Forum. And so they regularly participate in these different global funding calls, and many Chinese scientists are funded. So I'm sure there could be work to increase the visibility and awareness of the funding calls, to increase the amount of funding that China puts into the funding calls. Of course, those calls are a priority to China. For example, I think that they will be participating in the upcoming call on tropical forests. So again, this is something that maybe you could share with the communities who you're engaged with who might be interested in participating. The other thing would be to work with the Chinese community and neighboring countries to again build capacity to participate in these funding calls, similar to what I shared that we have been doing in the Americas, to help build research teams, to help train, but in ways that are relevant and specific and context specific to the priorities of China. So that would be another important step, would be, so not only to put more funding in the funding calls, but to again build the capacity and networks, again, to break the status quo, not just sort of the groups that are already established and already getting all the money, but to bring in new early career scientists, groups that have been underrepresented in funding calls, and support their capacity to now apply and receive new funding that China is putting into these Belmont Forum funding calls.
Thank you.
Thanks.
Hi, Anna. On that thought, I have a question for you. So you laid out this beautiful system that you're doing to build capacity, right? Before the call, before the funding is, and interdisciplinary, multiple disciplines working together, and all of that beautiful free training that you did. Can you just talk a little bit about the landscape of that in the world? Like, how often is that happening? I think it isn't.
Not.
Right. Okay, and it seems like a no-brainer, right, in order to disrupt what's going on now. And so, just tell me about the landscape of that. Like, is there anybody else doing that? And then, if there really truly is no one else doing that, who should be doing it? Like, whose role is it? The Belmont Forum, I can't do this for the world. Like, where does the responsibility fall in the different nations, in between the nations, globally? Just tell us about the landscape.
It's a really good question.
Just before you do, we're running near time, so I would just like to get the other question on the table and then ask you, Anna, to answer quickly.
Respond to both, sure.
Good morning. My name is Raisa Sorgo, and I'm with the Public Health Institute, more specifically the Center of Wellness and Nutrition. And my question is regarding these structures of funding that you discussed earlier. You mentioned how it's important to change these structures because part of that is what creates a power dynamic within collaborations. And my question is around ways in which we can kind of push funding institutions to look outside of the current model. In a previous project where we won a multi-million-dollar project with a funding institution, in the first 3 years of this project, we only were allowed to have one PI, which meant that there was one institution that really controlled the funding, and that was, of course, a European institution. We had to wait to successfully have this project before being able to force the institution in the second funding phase to understand that that was a model that didn't work. Although it was successful, we had 10 scientists co-write a letter to the funding institution kind of explaining why that model didn't work, and it did force them to kind of allow us to use a different model for the second phase. But I feel like a lot was lost in this first phase where we did have to abide by the system that they had. So my question is around what other ways and methods have you seen or used to kind of push institutions to find new ways of funding, to find new systems when it comes to that?
What comes to mind is advocacy. So, taking that letter that you wrote and publishing it in some high-impact journal or newspaper, working with, if it was in the US, working with legislature to push forward or to, bring to light. For example, if now the Belmont Forum is going forward with adopting this equity, diversity, and inclusion policy, there will now be funding agencies around the world that have agreed to this. And so you can go back and say, look, we have this policy that you are a part of, and this is totally not in alignment with what you're doing. But I think we need to make some noise and to talk about it and to be visible and to speak up and rally people around the world to be able to say this is not okay, we cannot continue to do work this way. And recognize that you have more power than you think to make change in these spaces.
Thank you very much.
Let me respond last to Desiree's question about who else is doing this sorts of work. START does a little bit of this. START is an NGO that works especially with African and Asian nations, although they were created around the same time as the II in the early 90s. The difference is that they're not intergovernmental, they're NGO, and so that is a difference because we have a different, role because we work directly with governments. Right now, we are working with Development Forum, with the National Science Foundation and other partners to put together a global coordination mechanism to support transdisciplinary research at a global scale, but that is still coming. But it has been recognized, NSF has recognized this as a major barrier, and they want to work with not just but other partners who are leading in the field to be able to create tools and processes, because we recognize that it's also a huge amount of time, it's a huge lift. You guys don't even want to know how many staff I have. We're such a small team. We're a small directorate, and we serve 19 countries. And so we have to think about ways that we can scale up, that we can kind of have hybrid modalities so that we can sustain these kinds of efforts in the future. So that's what our hope with this new sort of TD coordination project is to develop that infrastructure which can serve at a global scale and to take some of the lessons learned from what we've already done.
Well, I would just like the audience to join me in thanking Anna for this